Good morning, friends. I am Dr. Sumeet Jaiswal, plastic and cosmetic surgeon. Today we are going to discuss with you some cases of rhinoplasty which we have done recently, and so that you can understand what is exactly the procedure is and how it's done and what is suitable for you, how much will be the cost approximately. We will tell you everything about the rhinoplasty. So this is our first case. You can see she is the 24-year-old beautiful girl from Northeast. Her nose is broad, depressed dorsum, tip is blunt. So we have done dorsum augmentation by using silicone, done tip plastic, and alar breast reduction was done. There is some swelling after the procedure which gradually subside after few weeks. We can use ear cartilage, septal cartilage or rib also if patient wishes for that, but most of the time we use silicone. This is another patient whose main problem is hanging tip. The tip of the nose is going too much downward. He wants his tip to be lifted up, and also the lower part of the nose is broad and tip is blunt. So we have lifted the tip by doing some adjustment in the lower lateral cartilages, put some columnar strut to lift the tip, and also done some cephalic trim of the lower lateral cartilage of the nose to sharpen the nose, and also we have increased the height of the nose. So you can see immediate post-op result. The tip has been sharpened, the tip has been lifted after the procedure. She's another girl from Bihar whose complaint was broad nose, depressed nose. Her nose face is vertical, is elongated, but the nose is depressed and broad. So she want projected nose, she want nose to be little bit more heightened. For that we have done tip plastic procedure in which we sharpened the tip and did dorsum augmentation by putting some silicone over it, and also we have done some alar breast reduction procedure to decrease the width of the lower part of the nose. In such cases the duration of the procedure is roughly around 1 hour to 1.5 hours, and most of the time patient discharge on the same day. And the thing is that there will be some dressing after the procedure. The dressing will stay there for 3 to 4 days, and you have to take some medicines for next 5 to 7 days. There will be some swelling. The swelling is more if we do osteotomy. We will see that type of cases also in which osteotomy has been done. So the swelling will mostly subside. Most of the swelling subside in next few days, 1 week or 2 weeks, but little bit swelling can stay there for 1 month or 2 months, but it's not too much. You can socialize, you can move around, you can resume your job after 2 days. The cost of the procedure depend upon how many things we are doing in the rhinoplasty. It's range from 50,000, 55,000 to 75, 80,000. Sometimes it's done in local anesthesia if only alar breast reduction procedure is done. That type of cases we will discuss after few images. In that cases in which only alar surgery is needed, only minor procedure is needed, nothing need to be done on tip procedure, that can be done in local anesthesia, that type of cases. And the cost in that such type of cases around 30-35,000 also, but most of the time general anesthesia is needed and cost is more. This is a male from Rajasthan, and the problem in his nose is that the lower part of the nose is broad and the height of the nose is also less. He want to increase the height. Tip also need to be sharpened. So in this case we have done osteotomy in which we broke the bone and nasal bone and we pushed it inside from both the sides. So width of the nose of the upper part has been decreased, lower part width is decreased by doing alar breast reduction, and height has also been increased. This is the case of alar breast reduction in which only this is rare type of thing that only single side of ala is bigger and one side is normal, the right side of the ala is bigger. So here we have done alar breast reduction procedure in which procedure is done under local anesthesia, and also we lifted right side of alar rim by putting some cartilage so that both side of the alar rim, both side of nostrils will look symmetrical. This is the last patient of this video in which the patient has nose which is bulbous tip, which has bulbous tip. Such type of patients have lot of fat under the skin in the tip region, and maybe cartilage may be large, so the tip is not well defined. It's bulbous tip. It's called bulbous tip. So in this case, again, we open the nose, open rhinoplasty approach. We remove extra fat lying under the skin in the tip region. We resect some part of the cartilage, and then we have put some suture in the both side of cartilages, so to lift the tip and also to sharpen it. And we also put something in the dorsum. Mostly silicone has been put under the skin, but in such cases cartilage can also be put from taking from ear cartilage. And you can see immediate post-op result. There is always some swelling in the rhinoplasty. The result improves in next 2 months, 3 months, or maybe up to 4 months. The final result may take up to 4 to 5 months also in some cases. So if you have any other queries regarding rhinoplasty, you can WhatsApp your images to us. We will tell you what is the exact procedure you want and how much time will take, and how much will be the cost for the procedure.